and recording the meeting. Very much looking forward to, as I said, another opportunity to hear directly from some of our kind of superstar grantees. This time we have some grantees doing some different activities than we highlighted other times, and so we're really excited to have them share their experiences thus far. And we're also very pleased to be joined by Surgeon General Dr. Burke Harris, who, as always, will participate in the conversation and serve as a reactor and ask questions of our presenters in turn. And so with that, I am very pleased to turn things over to Dr. Burke Harris for a couple of opening remarks before we move to our presentations.
Sure. Hi, good afternoon, everyone. I just wanted to open by thanking all of you for the incredible hard work that you all have been doing. I am so excited to hear what you've been up to and how it's going. And I know that you all are really doing the very hard work on the ground to implement the ACEs Aware initiative and really bring the resources and the connections to our communities and to our families in the ways that we know that it needs to happen. And as I know you all know, when the mission of the ACEs Aware initiative is really to raise awareness, to equip providers and clinicians with the resources and the tools to be able to screen for ACEs so that we can do an ounce of prevention instead of a pound of cure, or whatever is needed at the point. And so I'm really, really excited to hear how you all have been doing that. I'm excited to hear what's going well, and honestly, what some of the biggest challenges are. I think that's where we do a lot of learning and can learn from each other in terms of how we're solving different challenges. And so with that, I will let you all go ahead and dive in, because I'm really excited to hear from you.
Great, thank you so much. And I believe our first presentation is going to be from Tri-City Medical Group. I hope I have that right. And I'll turn things over to you all. Tri-City Mental Health, I'm sorry.
Well, hello, thank you so much. My name is Lisa Naranjo, and I work at Tri-City Mental Health. I'm the Prevention and Early Intervention Program Supervisor with Tri-City. I just want to thank you for the opportunity to us to highlight all the great work we've been doing since we've been awarded the grant this past year. But before I even continue, just have to acknowledge all the other support from staff who've been working on this project. I know on the call we have Chris Anzalone and Hanna Sprague joining us, but there's also other staff who I just want to quickly give a shout out to, which is Heather, Isala, Daisy, Trevor, Carrie, and Sylvia. So thank you so much for all the hard work we've been working on this grant for the past year and a half since we started. So just to give everyone some background on who we are Tri-City. We are the Mental Health Authority for Pomona, Laverne, and Claremont. Those of you who are not aware, we are actually a joint powers authority. We are tasked to provide mental health services to family and children's within the 3 cities. We're unique in that sense. Even though these 3 cities are located in LA County, we are the mental health authority who serve them directly. And so since 1960, we've been the JPA for the 3 cities. And this is our 60th anniversary. So we're really excited to be serving our communities for 60 years. And when we talk about services, we talk about outpatient services that we provide, but we also, for adults, children, and the families, but we also provide non-clinical supportive services through our Mental Health Service Act funds, through state funds that we received through Proposition 63. Next slide. So building on our mission, becoming a trauma-informed behavior center of excellence, Tri-City really has been thriving for several years to build a center of excellence to be trauma-informed. And prior to this grant, receiving this grant, Tri-City has really looked at how we can create a framework to better support not just our staff and clients, but the communities that we're tasked to serve. And in doing that, we really looked at what are some frameworks that we can use, the trauma-informed framework is one that we model after, and looking at the recovery model. But what are some trainings and skills that we needed to armor our staff with to be prepared to deliver services that work around that framework? And we first started off with starting trainings and presentations on adverse childhood experiences. We've been doing it for over 5 years now, as well as we looked at and have implemented our community resiliency model and trauma resiliency model. And these models, these three curriculums that were developed to really first and foremost train, prepare our staff to become trauma informed. What does that framework look like? And using these three curriculums was the baseline foundation to train our staff to build an understanding across services for everyone to be more trauma informed, and just cultivating a culture of language and sensitivity around the topic of trauma and toxic stress. From there, we really felt the need to broaden this platform that we've created to our community partners. We want to expand it to other service providers, other organizations, nonprofits, community-based organizations, so they too can start being able to network with us and build that, that community language of what does it mean to be trauma informed, and how do we support ourselves? How do we not re-traumatize our clients when we're referring them back and forth, but building a system of being sensitive to the clients that we're serving. And after that, we really have taken this out into our communities. We do, within my department, our PEI department, we do a lot of trainings, education, workshops, seminars on how to be trauma informed, how adverse childhood experiences impacts our children, impacts us as adults. What can we do to support, create systems of support in our communities so to minimize the effects toxic stress has, not just within the children currently, but the adults, obviously, that we serve as well. Next slide. The next slide, please. So as we have been doing the work for 5 years and just really trying to find different avenues to expand this, when the Surgeon General's platform of ACEs Aware Initiative was launched, we were found, I'll admit, I took those emails and I shared them with colleagues and said, this is just great news, so exciting, because it aligns with a lot of what we've been trying to accomplish within our agency and expanding to our community partners. And so when we looked at the initiative and we looked at the first round of grants and the opportunities that were provided to all across California, we really took a look at that and said, with what we already have in place as an agency, working on a framework of trauma informed and looking at the ACEs Aware Initiative and the goals and mission of that, how can we do a happy marriage of those two and build on it? And after reviewing the grant opportunities, we felt best that to go for the supplemental training and the communications grant. And we're happy to say that through the process, we were awarded both of those grants as the Tri-City Mental Health Authority for the 3 cities. But also very happy because through this grant, it opened the doors for us to not only serve our 3 cities, but expand beyond our 3 cities, our neighboring cities, our neighboring counties, and build on collaboration and efforts that serve a larger population and communities that we all are trying our best to become trauma informed through ACEs Aware Initiative. So with the goals for those, both of the grants that we are awarded, for the supplemental training, we already had some content curriculum that we had established and created as already providing ACEs workshops and trainings. So we took those as a foundation. For us, our goal has always been, just as we want to educate providers, we want to educate community. And if you look at the great flyers and artwork that was created by Hanna and our team, we really also want to be conscious of the messaging. So not only do we want to support providers and providing them a training that talked about the science around the research and the findings of ACEs and how that is so important to understand and learn and start having those conversations in their practice and start screening for adverse childhood experiences. We also wanted to empower our community members, family members, educators, people who are not doing direct services, but also serve their community in various capacities. We also wanted to be able to create a platform for them to be trauma informed, to learn about toxic stress. A lot of them do the great work. They're on the field, they're on the front lines doing this work with families and children's and foster care systems. So we also wanted to create a platform for them to educate themselves on adverse childhood experiences. We have a really great network of partners that have been working with and continue to work with, and from this initiative have expanded and created new partnerships across county lines to really establish a network of cross collaboration. How can we support you and how can you support us, all along using that same messaging and the mission of ACEs Aware as the overarching umbrella across those relationships. For communications, what we really were looking to do is just expand and leverage a lot of what we've been doing in our communities. And I will say, you know, we awarded the grant right in the midst of this pandemic. And I really think for our communications grant, it really challenged us how to communicate and spread the word, when a lot of what we used to do was literally be out in the field, connecting with people face to face, meeting with them in person. So the fact that we were awarded this grant gave us an opportunity to kind of beef up our social media presence, have postings in our local newspapers, to outreach to providers using various platforms than what we were used to prior to COVID. Through communications and our trainings, we both wanted to just expand resources and tools, whether it be attending a workshop, a supplemental training through our grant, or being given virtual toolkits and resources that they can share on their websites. A lot of linkages to not only our pages, but the ACEs Aware initiative site as well. Next slide, please. So this slide really just kind of highlights the community partners that Tri-City has established over the years and continues to build on, and we kind of foster these relationships, and we look at them as our allies, our frontline folks who have been since day one, taken this initiative and really have participated in a lot of what we've had to offer. A lot of these agencies came out and supported our efforts before the grant, and as a grantee have really stepped up and supported our efforts as well. A lot of these are within our 3 cities, but also provide services beyond our 3 cities. And there are a variety. A lot of them are medical providers. Some of them are educational institutions. Some are services, direct services for domestic violence survivors and survivors of sexual assault. Also, just want to highlight East Valley has been a great partner. They were one of the agencies identified in our application as a partner, and through working with them and supporting them support our efforts, when they applied and received their second round grant for a network of care planning grant, we partnered with them. So there's cross collaboration, and I just see it as a scaffolding effect that we have here happening within our area to support each other's efforts to bring this initiative to the forefront. Next slide. So one opportunity that we've had was through the grant and through the funds of the 2 grants, was to invite Dr. Vincent Valetti to come and do a presentation. Through this process of the supplemental training grants, we wanted an event to kind of kick off and invite people to start attending our trainings. So one thing we did was reach out to Dr. Vincent Filletti and ask that he provide a presentation to anyone and everyone who would be willing to attend. And really our goal was for him to talk about the research, being the co-principal investigator of this research, to come and talk about not just the initial studies, but the findings and how those findings are still relevant to today and how we treat and heal our clients. And like I said, we open it up to everyone. So even though he's a medical doctor talking, we understand medical providers may have taken to his presentation more likely because they speak the same language and wear the same coat. But we also open it up to community members, to community providers, non-medical service folks, just so they could hear what the initial study was and what the findings told. So when we launched our supplemental trainings, it was kind of just another scaffolding effect of building off of what they heard from his presentation. And I will say that a lot of the feedback is very good feedback, and the stories that he shared from his patients really resonated with not just provider, but community members, folks who may have not heard of the study before or been aware of the impact it's had. At the day of the event, we had over 400 people register. We had 285 in attendance, which is a really great launch event for us. We had folks from as far north as Yuba County, as far south as San Diego County. And the feedback, like I said, they felt the presentation was excellent. A lot of people strongly agree that they had a better understanding of ACEs. And the key thing that we want to take away is how likely would they attend future ACEs trainings as a for this presentation. And they all said very likely, which is really great because we with the 2 grants. Next slide. So finishing strong, how we really want to wrap up, we are in June. This is the last month of the grant year. Fortunately, with the grant extensions, we will continue to do this work for at least another 6 months. But where we want to continue to grow this project and expand is for first and foremost for the trainings is to keep on providing them, keep on offering them. These last 3 months, we have offered over 10 trainings. We've set up trainings and invited everyone to come. We've trained over 250 people since then in our supplemental trainings, both provider and the community version of it, as well as for our communications grant. Really want to dedicate more concrete space on our website, create a whole page of being ACEs Aware initiative. Serves all our community members. And right now for our service area, we have a large Spanish speaking community, monolingual, bilingual, Spanish speaking community. And we cannot provide a meaningful initiative, a messaging when we are not delivering content that is in the language of the community we're serving. Language is important and it's powerful. And I hope to further collaborate with ACEs Aware and other grantees. We have staff who are bilingual, who can speak the language and who can translate. But one thing I will commend of this initiative is just the mindfulness, the intent, the purpose of the messaging, the consistency, the universal language, and trying to get universal language in English, but now to do it in other languages, can be a challenge. And so that's one thing we hope to finish strong for this next 6 months is all the great content that we've created to start delivering it in Spanish and other languages that serve our communities. So we feel we've outreached to everyone because they're just as much a part of our community. We want them to feel a part of our community and to be as trauma informed and ACEs aware as everyone else. And that's about what I have for right now. I think my time, hopefully didn't go over. If anyone has any questions or comments.
Yeah, thank you so much, Lisa.
Sorry for the timing.
Appreciate the great presentation. I apologize, I didn't talk about the format of today's session at the opening, but what we'd like to do now is turn to Dr. Burke Harris for any kind of reactions, questions that she might have for Lisa and team. And then we'll go to the next presentation and the next, and then at the end, we'll kind of wrap things up with opening the floor for questions from the audience. So Dr. Burke Harris, can I toss it over to you for any thoughts or questions you'd like to pose?
Sure, yeah. So congratulations on your I think my first question, I heard you say that the pandemic really presented some of the biggest challenges in terms of outreach because you typically do a lot of outreach in person, and so you really had to focus on doing a lot of that outreach through social media. do you feel like, what did you learn in terms of the differences between doing the outreach in person and the difference in doing the outreach via social media, in terms of communicating about ACEs and toxic stress?
For me, I feel the pros of social media is we had a greater outreach. Again, it went beyond our service area. We were able to connect through social media. You can go all throughout California and not have to worry about, physical distance, but you can outreach to a broader audience through social media, through platforms. And I think the outreach was greater. What for me, and I think what the disconnect is, I'm all about personal relationship building and having intimate face-to-face conversations. I can post something on social media, they can read it, but I love to sit down and talk about it. Like, what does this mean? What does this look like for you? What does this look like for your community, for your clients, for your patients? And have conversations, because I'm sure people saw that and said, I don't get it. Or, oh yeah, that sounds good, but I don't know how that applies to me. So although we were able to expand and message our campaign and our efforts to a larger audience, for me, the connection with conversation in an intimate setting to say, this is what it is, this is what it looks like, but how does this look for you? How could this work for you? How can we support your efforts and have those conversations? And I feel people, I know for myself and speaking for myself, miss that probably the most, is that connection piece. So there's good, we can reach out to a lot more people, but the downside is we can't have those conversations to really hear people and feel validating to say, I hear you, that makes sense. And how can we now come up with a way to deliver that in a meaningful way? And
Yeah.
hopefully we can start doing that as of today.
Yeah, so that's powerful. So the thing about social media is that you can get your message out, but you can't hear other people. You can't have that connection where you are essentially able to understand how it's landing for them.
Yeah, they like it, so we can go by number of likes, but again, that's
Yeah,
say a whole lot. Yeah.
yeah, exactly. That's powerful. That's really helpful. Thank you.
Thank you.
Was your event with Dr. Filiti, was that in person or was it virtual?
It was virtual. Our
Okay.
goal when we first planned it was to be in person. We had a West University to connect, to hold the space, a large auditorium. But again, the pros and cons, it was virtual. So again, that interaction, but we were able to reach a lot of audience. People from Yuba County came.
Yeah.
I don't think they would have taken a trip to, to our little agency to attend. So again, the beauty of virtually is we connected to a lot of people. The downside is that connection, that conversation in person.
Yeah, that's great. Thank you.
Thank
and
you.
You're going to do more of that now with the grant extension, now that the state has reopened.
Yes.
Okay.
Yes. Oh, you, Dr. Burke, you don't understand. I am just itching to get out there and have conversations. And as I said, is still do our trainings. Our trainings are key, but how can we support you? Like, I think the implementation, people are still kind of questioning about, how do I do an assessment? How does that look in my practice? How do I do it?
Yeah.
And so just having those conversations, and let the supplemental training be the platform to learn and then have further conversations. And ultimate goal is to get them to the core training, to get them their certificate to do that. And how do we be a vessel for that?
Great. Thank you.
Thank you. It's been an honor.
Thanks so much, Lisa. Great. Okay, next we're going to turn to Linda Baggio from the Kings County Department of Public Health. Linda?
Hello, everyone. My name is Linda Baggio, and I am the ACEs Aware Program Manager with California Health Collaborative. California Health Collaborative is one of 4 organizations who are partnered with the Round 1 grantees to carry out the message of ACEs awareness and hope. We are happy to be highlighted at today's Spotlight event and look forward to sharing with you the accomplishments of the Kings County ACEs network of care within this grant period. Next slide, please. Kings County ACEs Network of Care is a collaborative partnership between Kings County Department of Public Health, California Health Collaborative, Kings Partnership for Prevention, and Kings United Way. We very much appreciate the work of all our partners who have committed to moving this work forward to improve the health and well-being of individuals, families, and our Kings County community. Under this grant, we were awarded to service the Kings County community on the 4 main objectives: develop and provide certified clinical and non-clinical supplemental trainings, network of care engagement events, peer-to-peer engagement events, and a communications component. And as you can see on the screen, here's our wonderful team and their very wonderful faces. Next slide, please. Thank you. I would love to take the opportunity to provide some background on our community. Kings County is listed as one of the top 4 counties in California with the highest reported prevalence of 4 or more ACEs between 2011 and 2017. According to kidsdata.org, Kings County has one of the highest prevalence rates of ACEs in the state, with approximately 24% of all households experiencing exposure to 4 or more ACEs, compared to 16% of the California's population overall. Another 48% of Kings County adults residents have experienced 1 to 3 ACEs in childhood and adolescence, compared to 46% of adults statewide. We know that this data was compiled pre-pandemic and that COVID-19 has likely increased the prevalence of ACEs and toxic stress for all communities. We also know that high-risk communities like Kings County may be disproportionately impacted by COVID-19 due to higher sensitivity to stress and infection. Our multi-agency collaboration recognizes the impact of ACEs in our community. We also know that ACEs are only one part of a person's story. Therefore, we are driven by pure passion and dedication to this work to help transform the knowledge of our community by increasing awareness on ACEs and building hope for a resilient Kings County. As leaders in this work, arm in arm, side by side, we have pledged to respond to our county's need for healing and prevention by directly engaging providers and community organizations into action to respond with trauma-informed care to mitigate ACEs-related health impacts. The collaboration of this multi-agency group has boosted creative and innovative approaches and practices that has helped us respond to the requirements of this project. We have fully utilized the existing partnerships of our organizations, which have allowed access to key stakeholders and potential partners that would ensure the continuity of our work for years to come. This has encouraged the diverse communication of our project, mission, and goals to the health community with tailored discussions and outreach across all leading partners. Next slide, please. The Kings County ACEs Network of Care team has worked to develop clinical and non-clinical trainings. The decision to provide 2 training options supports our understanding of the diversity in service from frontline clinical workers to community agents who add value to the screening, education, and referral for ACEs. Therefore, we have worked to develop a tailored learning experience appropriate for each population. The clinical component serves to educate medical physicians, social workers, case managers, medical assistants, registered nurses, nurse practitioners, and behavioral health staff, to name a few. The non-clinical component serves to educate front office staff and administrative staff, as well as all of those network of care community members that we want to stay abreast of the latest information regarding ACEs and toxic stress. To ensure that there was a cultural footprint surrounding the work of ACEs in Kings County, we empowered our community to be involved in the creation of our clinical training, which enhanced the community buy-in and uptake. 2 critical components of our training actually came about from our communication with our community. It allowed for the collaboration for us to include a section regarding motivational interviewing and the ORS acronym. For those who don't know what the ORS acronym is, it means open-ended questions, affirming, reflective listening, and summarizing. With their contribution, we're also able to highlight the usage of the de-identified screening to prevent re-traumatization of the patient. Not only do both trainings include an overview of ACEs, they also go into depth regarding toxic stress, social determinants of health as other adversities, resiliency, and what it means to be trauma-informed. We incorporate mindfulness exercises, which are one of my favorites, Mentimeter engagement, data regarding the prevalence of ACEs, and patient-centered care. Additionally, local resources are presented for a robust community network of care through communication of local 211 services and a King's referral exchange system with our partnership with Unite Us. However, the clinical training goes into more depth and clinical detail of the ACE screening tool, the algorithm, and their implementation. Our community's response to the trainings have been overwhelmingly positive. Feedback received supports the inclusion of local data and incorporation of resiliency practices. A local healthcare facility has explored ways to include our offerings in their provider training platform to encourage medical providers and medical school residents in screening efforts. This response has allowed us to develop a memorandum of understanding that will allow for our training to be shared within provider learning platform with a completion requirements by providers contracted within their facility. To support the sustainability of our trainings, we have created an e-learning website using learnworld.com, which will allow for a self-led continuing education with supporting resources from ACEs Aware and tailored resources from our collaboration. We hope to include recorded media from all engagement and training sessions within the LearnWorlds platform. The launch of this continuous learning webpage will allow us to extend our training resources statewide to providers who may not have had the capacity to join us due to the current pandemic. As I go into further discussion, my team will be including links that support the language of the information that I do share today to help support your understanding of the links we do communicate. Next slide, please. When the ACEs Aware grants were awarded, it was important to all partners to immediately begin facilitation of our network of care events. Immediately became apparent to the Kings County ACEs network of care that our community needed the basic understanding of ACEs. Therefore, we put into action and we worked in the first months of implementation to train our community by offering background knowledge on ACEs, supported by data trends present in our community, while emphasizing hope through resilience. Under these efforts, we shared a message supported by the power of you, which means that each individual network of care member has the power to take in the knowledge of ACEs and a trauma-informed care and apply it to their work. Following the release of the Network of Care Roadmap, which changed my life personally, Kings County ACEs Network of Care was transformed by the additional guidance offered. We immediately worked to establish a robust network of care that would include the mentioned key stakeholders and offer a focus on the milestones and goals set forth to lead screening and referral efforts in Kings County through the collaboration of health and community service organizations. Our shared messaging changed to support our transformation of knowledge from the power of you to the power of community. This change has allowed us for a focus on community, which offers a recognition that it takes community action to push this work forward. While holding on to the power that we have as individuals, a collective active participation of support from families, patients, organizational champions, healthcare workers, and community members at large will support the efforts to cut ACEs by half in one generation. Our move in this direction has inspired the development of a joint network of care logo, which you see next to me on this side. This logo represents our network of care community, where all organizational efforts stand under one representation in support of our bold goal and mission. This logo and name change from ACEs Aware Kings Collaboration, which you might have recognized that we were named of, and now we've changed it over to Kings County ACEs Network of Care, stands for Kings County's pledge to spreading the message of hope, noting that ACEs don't define our destiny. The logo reflects the diversity of our community and how network starts arm in arm and side by side, together to change the face of ACEs in our community. This logo is supported by our Network of Care toolkit that will guide community efforts in integrating to this work. We will go into more detail about our toolkit as we progress through this presentation. As a community in power, we are all responsible for creating awareness and integrating our services in support of provider screening efforts in Kings County. Over the past 8 months, under a multi-agency collaboration, we have hosted 8 network of care sessions and established an intimate network that consists of over 56 active participating members from 51 different organizations. Recruitment of immediate members to our network of care was made possible by the diversity of organizations within our collaboration, which we utilized to reach out to existing contacts of over 450 social service providers in the community. This included the addition of clinical providers, Adventist Health, ARIA Health, and Family Healthcare Network, where these existing relationships served to foster greater cohesion of a diverse and sustainable trauma-informed network of care. We understand how crucial it is to cut ACEs by half in one generation. Therefore, all project partners are working side by side to develop a process for lifelong implementation to support the bold goal. The Network of Care Roadmap and the Roadmap for Resilience has helped inform all planned Network of Care sessions that we've hosted. We've utilized the information contained within the roadmaps to incorporate evidence-based strategies to support our bold goal, set leadership goals, and inform community on accountability, and expand our network to include key stakeholders such as faith-based leaders and tribal communities, to name a few. Additionally, these valuable roadmap resources will serve as a guide for creating sustainable Kings County ACEs network of care and provide a foundation to evaluate the effectiveness of our work. We understood the traumatic impact of COVID-19 to our community. We thereby discussed the value in sending a message of hope and self-care throughout our community. All community registrants and attendees within our engagement and training events were delivered a welcome box, which when opened has an opening message that states, "Welcome to the first step of changing lives through ACE science. We are honored that you will be a part of our experiential event that aims to transform your knowledge into practice. Thank you for joining us on the front lines. We look forward to redefining the approach to trauma-informed care and the Central Valley with you." I really love that message. And one of my team members will be including a link to the box, what the message looks like. The welcome boxes were implemented to inspire and encourage ongoing participation and ownership in being a part of this work. We have distributed welcome boxes to 178 attendees throughout our engagement and training events. And response to the Kings County ACEs Network of Care welcome box has been overwhelmingly positive. I'm also happy to report that we were able to share some of those boxes with Dr. Nadine Burke Harris as well during her visit in Kings County. Each welcome box includes information about upcoming sessions, additional opportunities for participation, 211 Kings County brochures in English and Spanish, and a variety of note-taking supplies, all hosting 211 Kings County branding. The branded material supports the organization's marketing of a referral platform to support this work. We're happy to share the design elements of this box, which will include our box template and costs in a resource document to our grantee community. That will also be included in the chat for you here today. If you're interested in learning more about how to put your own box project together, please don't hesitate to reach out to our team. Next slide, please. We recognize the diversity of our county and the many people impacted by ACEs and toxic stress. In order to address the needs of all the communities within Kings County, our network has partnered with the Unite Us digital platform to connect community members to specific resources and services. The referral exchange is building a network of organizations that are committed to the continuity of care in Kings County. We understand the value in connecting patients to a network of care that supports the treatment of toxic stress through evidence-based interventions. The Kings County Referral Exchange via the Unite Us platform is a secure, closed-loop electronic referral system that facilitates connections between organizations. It is a versatile tool that serves as a database for providers and supports them in sending referrals to local community organizations, connecting clients to appropriate resources that help address toxic stress. The platform has longitudinal records for clients, and each client has to give consent to receive services and also can revoke this consent at any time. Email notifications let organizations know when a referral is sent, received, and fulfilled, and the client can opt in to receive notifications so they can have an active role in their own care, which is so important to us. Presently, we are working with key organizations to get them connected to the referral exchange and join 33 organizations and counting that have already joined a network of care partners where faster connections are made and made to support the health and care of the community, 211 Kings County also serves as a tool to find local resources and services from government, community, and nonprofit organizations. The benefits of 211 and the referral exchange services are communicated during our events, where we highlight categories of resources to mitigate toxic stress, such as mental health, physical health, and food services. 211 Kings County is working on creating a page on your 211 County site for resources that address items on the Stress Busters bill, making it easier for patients and providers to find those specific resources that we are communicating about. Kings United Way Community Engagement Manager Lexi Terrell provides personal support and guidance to organizations looking to join the Kings Referral Exchange platform. Lexi is on the call with us today, and we will be providing her email in the chat if you would love to learn more about the Kings Referral Exchange system. Next slide, please. The need to prioritize sustainability has never been more urgent than it is today. Our multi-agency network has worked to put in place sustainable development practices within our training and engagement events. In support of sustainability efforts within our network of care events, our collaboration created a Kings County Resilience Tracker, a metric that helps to define sector progress and address gaps in stakeholder representation that may impact sustainability. The development of this tracker was initiated by our review of the Network of Care Roadmap, which allowed us to ensure a diverse representation in our network based on the key stakeholder list. The Network of Care Roadmap has also helped increase provider buy-in and enhance the coordination of goals, accountability to support the program implementation and ongoing reflection. In support of practices gathered from the roadmap, we have developed a Network of Care membership form to expand our sustainable practices. The membership form supports the ask for our community to join us in immediate action to respond to ACEs. This membership will also serve as their organization's commitment to care to prevent ACEs in Kings County, support their dedication of time and energy to provide access to evidence-based buffering resources, and help to prevent, treat, and heal the harmful consequences of toxic stress. Under this membership, we plan to foster hope by providing guidance for the inclusion of trauma-informed organization practices and to assist with the development of protocols and policies that support patient-centered care, in addition to encouraging clinics to complete the Becoming ACEs Aware training. We are most proud of the dedication of our internal network of care leadership in fostering a culture of support and self-care through regular check-ins, which are my favorites, that are hosted weekly to support progress and reflection on goals. Within these meetings, we make it key practice to offer a resiliency question that provides an opportunity for our teams to come together to share and express their thoughts, their feelings, and responses to questions that help staff grow in relationships and connect with one another. Even though COVID-19 has been keeping us apart, we're still finding ways to strengthen our connections by building on the relationships that support us. In addition, we have encouraged all leading partners to complete individual ACE screenings. In that effort to promote compassion amongst participants and establish a culture of passion to drive this work forward. As part of our leadership team, I am part of building this culture. My life has been transformed by this work, and I stand in my power with an ACE score of 10. I am committed to stopping the cycle of trauma, which ends with me as I raise my 2-year-old son. We're committed to changing lives through a trauma-informed lens. To me, these are the lives of my siblings, my mother, my husband, my community, and the organization I represent. Next slide, please. Almost got teary-eyed there. To support the sustainability of ACEs awareness in our community, we have developed an ACEs Community Resource Toolkit that has been distributed to all Kings County organizations who have committed to care in support of this work. This resource kit offers valuable action steps that can be incorporated within any organization. The toolkit, the Kings County ACEs Network of Care Toolkit, is a resource for both medical and social service providers in Kings County interested in being part of the greater Kings County Network of Care. The toolkit serves as a guide for organizations and teams to join us in establishing trauma-informed processes that will help ensure our network of care remains strong, sustainable, and diverse. Within the toolkit, we encourage organizations to break down their programs and identify the toxic stress mitigation and/or social services that they offer to their clients. This toolkit serves as a long-term resource that will memorialize what we have learned during this process and propelling our community forward in building hope and addressing ACEs in Kings County. The toolkit will help our network and continue our ACEs work in this community, since it will be applicable and resourceful long-term, creating a sustainable trauma-informed network of care community moving forward. In our effort to motivate organizations and teams to make a commitment to trauma-informed care practices, we have implemented a reward system within the toolkit that ranges from social media promotion to a free self-care session for your entire office and a personalized commercial video for promotion. The Kings County ACEs Aware Network of Care is also developing a Dear Kings County video. The video will showcase organizations and teams who are committed to being trauma-informed and building resilience in Kings County. This video will show the diversity, commitment, and strength of the Kings County Trauma-Informed Network of Care. The video will act as a first look for the community to see which organizations are on the forefront of this ACEs and trauma-informed movement. We want our community to not only understand the importance of ACEs, but also admire and appreciate the work of organizations and teams participating in the Kings County Network of Care. The value of our work is being recognized across counties and has helped to improve shared resources, enhance integration, and continuum of care. We're currently working with the ACEs Aware Grantees and other organizations devoted to this work to host the Central Valley ACEs Leadership Meeting. This meeting has 16 representatives from Kings, Fresno, and Tulare counties, who I know are in the room with us here today. I feel extremely blessed to be a part of this work. As I stated before, my life and the lives of those who learn about ACEs Aware Kings Project has been positively impacted. I am honored to work alongside my team at California Health Collaborative and our round one partners, Kings County Department of Public Health, Kings Partnership for Prevention, and Kings United Way to carry out this essential service in our community. We are honored to expand this partnership with the Round 2 Network of Care Planning Grantees to include 3 of the largest medical providers in Kings County: Adventist Health, Aria Community Health Centers, and Family Healthcare Network. California Health Collaborative has also partnered with an outside policy research firm, EMT Associates, to assist with product development and reporting. The second funding award supports the continuing development of trauma-informed networks through efforts to create and sustain formal connections between medical providers, social service systems, and community partners to address toxic stress through clinical and community intervention following an ACE screening. As leaders of this work, we continue to stand arm in arm, side by side, to infuse the message of hope into our community, because healthy outcomes come from positive experiences. Next slide, please. And this slide serves as a summary of the way to connect with us and contact us. We would like to invite you to join us in our engagement events, access our recorded clinical, non-clinical network of care and peer-to-peer events in our Learn Worlds. And thank you so much for the opportunity to present to you all today. It's been a great honor.
Thank you so much, Linda, for that lovely presentation. Really, really appreciated you sharing your experience. Dr. Burke Harris, can I turn things over to you for some thoughts and reflections?
Sure. You got me all teary-eyed. It is amazing to see what you guys are doing in Kings County. And it's amazing to see the need being met with the passion and the brilliance and the rigor and the thoughtfulness and ingenuity. It's inspiring. It inspires me. Yeah, it's really, really powerful. And I'm blown away by what you all have been able to accomplish in partnership with so many organizations and entities. And I would ask the question, what do you think has been the key to your success in getting such collaborative engagement from so many partners?
Great question. Like I mentioned, we have hosted these sessions where we first had the opportunity to know each other, because that was really important. In order to work and share our passion together, we had to communicate in a really deeper level, understanding ourselves. And that's built through the resiliency questions that we were able to connect every week when we met. We laughed before we got into the serious conversation of instilling hope in our community. And most recently, over the last couple of months, we've utilized the project platform Smartsheet. And this really served as a way for us to communicate our project across multi-agency collaboration with deadlines, accountability through line items being assigned to certain individuals. So it's like, my name is on this line, I'm gonna get that task done. And that's really helped us push the work forward to ensure that everyone is pulling their weight and accomplishing this large goal to meet our goals before the end of the grant period.
Wow, that's fantastic. And you know, one of the things that I'm really interested in understanding is, you know, I hear and I recognize that a lot of this work was work that you all were already doing, right? It was work that you've been working on for some years now. And one of the things that's helpful is for me to understand, for us to understand how the grant funding, I mean, I can see all the work that you've done, but you know, what is the difference that the grant funding has made for you all in terms of, is it the ability to bring folks together? Is it the resources to have dedicated teams? What do you think has been the most impactful piece?
I would love to rely on one of my partners, the leaders in this call, to help support the response to that question. Daisy Lopez.
Sure. Dr. Nadine Burke Harris, thank you so much for having us here. We're so excited. I definitely think that, you know, as you mentioned, we had been doing some of this work. I think all of us in the Kings County ACEs network of care organizations, we had already been doing kind of pieces of this. But I think like having the resources, having the dedicated staff, Linda is actually full-time in the ACEs Aware contract with us. So she gets to spend like her whole entire day, you know, really planning out activities, coordinating with partners, really keeping us on track. She's really been a really fearless leader for us to really do this work while the rest of us, you know, are integrating into our existing programs, our existing services. So really having, you know, partners at the table that are fully funded, that are able to just kind of spend the time and really dedicate themselves into this work has really made the difference. As we mentioned, a lot of the organizations in our community, we're finding ways for them to integrate it into their existing organizations, their existing program services. You know, how do we get them to become trauma informed? How do we get them to see everything through that trauma informed lens so that they can be better, you know, community partners in this work? And I think just having the support from somebody like Linda, like George, who's also in the room, we have Stacy, you know, other members of our team, Lexi, who are really like dedicated staff. They're there. We also have Karina and other staff members that aren't in the room, you know, has really helped to be able to build those partnerships and those relationships with the organizations, because they spend a lot of their day calling organizations, asking how can we help, walking people through steps. Lexi has been doing a lot of work to get people, you know, through how to sign them up to become part of the referral exchange. So definitely they're instrumental to really kind of like taking it from like we were taking baby steps and everyone was trying to do their best that they could, but really taking it into like full force. We're off the diving board, like Linda's swimming, everyone's coming after her. Like it's been amazing. And I'm so grateful for the opportunity to do this work. It really, like Linda has said, has been life-changing for a lot of us. And I think a lot of the organizations in our community have just, you know, really taken the opportunity to take advantage of all the resources to really move their work forward a lot quicker as well. So we thank you and the organizations that have really put this initiative forward.
Awesome. Last super quick question. So I'm going to say, aside from more money, because more money is always helpful, are there any particular resource that would be helpful, whether it's an academic resource or, you know, just to remove barriers and help to catalyze the work further?
We recognize our network of care to be that foundation for that continuity, and we are finding a way to make sure that representing organizations are embedded in this work to help push it forward. We know that hosting a network of care session for years to come might not require a lot of funds. It just requires an active, passionate person to lead it. So we know that that's the foundation to continue to integrate that care, continue to serve, ensure that organizations are together and continue the conversation about ACEs. So that's where we find a lot of strength in, is within that network of care.
Thank you. That was powerful. Thank you.
Thank you so much, Linda, and thank you for your leadership. I think you've absolutely made an impression on every single person on this call, and I had already heard about you from Lily Clements, your grant liaison, who is also a big fan. So great. We have one more speaker ready to go here. I am really pleased to hand the mic over to Erin Hawkins from the Hanna Institute.
Thank you so much. Thank you, everybody. I am so inspired by what I've heard today. Like, it's like taking me a minute to catch my breath. I'm really taken away. I've taken lots of notes to share out with my colleagues and my team. But yes, my name's Erin Hawkins. I'm the co-director at the Hanna Institute, and I'm really grateful to be here with all of you today. Also online are just a few of my incredible team members. I have my fellow co-director, Nick Dalton, our community engagement and research coordinator, Richard De Leon, our interim chief development officer, Marissa Binder, and our PR guru, Kelly Exner. And I also want to acknowledge a few of our community-based partners, some of who are themselves ACEs aware grantees from our Sonoma County community. So if I could get the next slide, please. So some of those partners are Dovetail Learning, Santa Rosa Community Health, the Redwood Community Health Coalition, and St. Joseph Health. And I also need to acknowledge the space that I'm coming to all of you on. The space I'm on right now, it's occupied traditional homelands of the Coast Miwok. And today in Sonoma County and in surrounding areas, they're still home to many Indigenous people, some of whom are our friends and our neighbors and our partners, and who continue to face obstacles that were placed there by colonialism, by forced assimilation, by environmental racism. And I, along with the rest of my team, would like to offer our respect to the Indigenous people on this land that we occupy today. We are humbled to have the opportunity to facilitate this presentation on this land, but we also acknowledge that gratitude and humility aren't enough. So we are committed to continuing to working together to mend and take care of this land we're on. I also want to share a bit about who we are, as well as where we're coming from. So as I said, I'm the co-director of the Hanna Institute at the Hanna Boys Center, but today I'm very much representing a larger collaborative that we established thanks to the ACEs Aware grant support. With our funding, we brought together partners from across the North Bay to establish Northern California ACEs Aware, a network of community leaders in health and education and trauma-informed care. We came together, we meet together regularly, we design together in order to leverage our partnerships with ACEs Aware, to share our expertise and our commitment, our funding, to align our outreach and education efforts, and to move all of our arrows in the same direction in order to build awareness of and screening for adverse childhood experiences. And ultimately, our ultimate goal is to improve the lives of kids and adults and build a healthy community here in the North Bay. And I'll be frank, the timing for our community couldn't have been better. I'm doing this presentation from my home in Santa Rosa. And over the past 4 years, I've had to pack up my kids and my car and evacuate 3 times for days at a time. And every day when I drive into work, I drive down roads of burned down neighborhoods. And so these 4 years of devastating wildfires, of floods, of rolling blackouts, of high winds, combined with the existing underlying continued racial and social injustice and the pandemic and shelter in place, our community has experienced a lot, and we've learned a lot. ACEs, it's not a new concept in our areas as it may be in other communities. So the silver lining of this location that we have and the events that we've experienced is that folks of all walks of life, they're a lot more willing to talk about adversity, to talk about trauma and stress. And our schools and our healthcare providers and our social service agencies have had a pretty decent amount of exposure to some of the basic concepts, and they've had some time to adopt some of them simply because our community needed it. And even aside from the natural disasters and the epidemics, the ACEs data in our community prior to that, with our rates just sitting above the state average over the past few years, that has also contributed to this momentum that's existed to educate and intervene and interrupt that we have had the opportunity to build upon. So this funding and support, what it's really done has given us a chance to capture the knowledge that these experiences we've had here, to capture them and share them out and share them widely in really interesting and exciting ways that I'm super excited to talk about. And that's what I'm looking forward to sharing with all of you today. If I could have my next slide, please. Thank you. As a provider engagement grant, both for the care and the activities, we've been able to really reach out far and wide, farther than we've ever expected to share. Not only in the 4-county Sonoma, Marin, Napa, and Yolo area, but we've had folks as far away as Ottawa, Canada, and in the UK. That's the silver lining, I think, of being digital, as some of my previous grantee brethren shared. Our limitations were really lifted by doing this work digitally. So you can see on this slide a list of some of the engagement activity topics we've been offering and the reach that we've had in terms just of live participation. And I should add that these numbers are just a bit dated. Since we submitted our slide deck, we've hosted a maternal mental health focused event, which included about 148 attendees. So we're just about to hit the 500 person mark in terms of engagement through our live activities. And we've really leaned into pushing the envelope of getting creative, especially in this digital space we've all been limited to with this funding. And we've been really excited about it. So we've hosted, with these facilitated learning sessions, we've used different times. We've done weekdays, we've done weekends, mornings, afternoons. We've tried big 4-hour chunks. We've done, 1-hour facilitated sessions. We have an asynchronous learning opportunity coming up soon. We've made them very interactive. We've done skill practice, dialogue and connection with other participants, group discussions, case studies. We've really, really tried to make it engaging. We've tried to live up to the engagement portion of this grant. We've been able to offer free CEUs and certificates of completion. We're holding live Q&A sessions with all of our facilitators. It's offering a space not only for them to share more, but also for the participants to mine the collective knowledge among them and share out. We've done blogs and flashcards, which I'll talk about a little bit more in just a second. And as always, it's been a chance to continuously refer back to the broader ACEs Aware initiative and the multitude of resources you have offered. And I want to share a little more detail about how we've done this engagement to outreach for these activities, because that's been a really valuable learning opportunity for us. If I could have the next slide, please. So as a provider engagement grant recipient, we've hosted TIC learning events, and I'll use that as those events as an example here. On the screen, you can see, almost a calendar or a sequence of outreach that we did on social media. We started with a launch of social media announcements that also aligned with email outreach we did, with mailing lists that we created with the help of our Northern California ACEs Aware partners through PACES Connection and just by digging online for emails and names. And this event was hosted through our network of care grants, so we could reach out really far and wide in terms of agency type to healthcare and Medi-Cal providers, of course, but also to schools and nonprofits, social service providers, government, religious organizations. We launched the information, we posted regular announcements to generate excitement and drive up registration. We created these really fun, short introductory videos that we sent to registrants for events to help them prep and get ready and know what to expect. And then immediately after an event was held, literally within 24 hours, we put out more social media posts. We sent out thank you emails and certifications. And then we reached out to participants to collect their quotes. And it was also an opportunity to share information about future events, about learning events coming from ACEs Aware from the state, and other related opportunities and resources. And we timed it, really intentionally with some of the other engagement mediums that we created that I'll talk about in just a second. Really what we were seeking to do was to maintain a steady rhythm of engagement and sharing and building and connecting with our audience. Next slide, please. So the engagement work we did was really deeply tied to our communication efforts. And I just want to say again how the grant gave us an opportunity to be really creative with our communications and our outreach. This included developing a really beautiful website, which you can see here on the slide, the shot of the homepage in front of you with the image of the girl in the wine-colored shirt and the words whole care, whole healing. And we worked with a small local studio agency called Good, who took the branding guidelines of ACEs Aware, and they sat with members of our community and our NorCal ACEs Aware group to just give it a little bit of that North Bay flavor to ensure that it was available in English and Spanish. And what went on this website was really great stuff. There was a combination of shared information, of pushing folks over to the ACEs Aware website, to the attestation testing, serving really as a conduit to drive traffic to the state, but also to create and share out our own content. So, as I shared in the beginning, it was mining our local knowledge and perspectives, and to do it in ways that acknowledge all the different ways that we learn and how people prefer to engage. So in addition to the live learning events and the asynchronous learning activities, Kelly, our guru, came up with a really brilliant concept called a flashcast, which is like a podcast but shorter. It's a bite-sized opportunity to dive a little bit deeper in a particular topic or on a particular population or skill, something that you could, listen to on your drive home or while you're folding laundry or riding the bus. We wanted to make it accessible in all sorts of different ways. We created blog posts on a whole range of topics. We shared resources and connections. We also work with our partners to create a flyer that we distributed to Medi-Cal providers and others along our network of care who have still been able to work in person. And we also generated radio ads in English and in Spanish to go out across the North Bay that were targeting 3 different audiences: Medi-Cal providers, network of care agencies, and the general population. And the general population outreach was something we felt really strongly about engaging with in our communications work. We wanted to just really help prepare parents and caregivers in particular who may be, coming up on a well child visit and might experience their very first Pearl screening. We wanted to use those radio ads to help introduce the concept so they didn't feel like it was coming out of left field for them. Next slide, please. So how are we doing? I've pulled out 2 quotes from participants in our TIC learning events, and I chose these quotes specifically to offer my gratitude again for this grant, and explicitly for the change, the request that was made after the first RFP went out to really highlight how we would address race-based traumatic stress and COVID. In light of the disparities that COVID had surfaced, and also again because of the community organizing that was occurring in response to George Floyd's murder, we were really grateful for that call and for that space that was made to us to let us deep dive in that area. And even though we know that race-based traumatic stress, it's not a big ACE, it's an associated risk factor, that there's compelling evidence for the toxic stress response it generates. It hasn't been fully demonstrated yet. Nonetheless, the fact that you made that call to action is really powerful. And the flexibility was there, so we ran with it. And we worked very closely with Dr. Daniela Dominguez, who's our director of research here at Hanna. She's also a psychologist at USF and a researcher and founder of On the Margins LLC. And we sat with her and our content and our ideas, and we turned things over and reframed and reconsidered. We connected her with some of our subcontractors on these engagement events. So for example, she worked with one of our presenters, Allison Murphy, who uses the ACEs questionnaire in her work as a therapist treating perinatal mood disorders, to talk about implicit bias and the perinatal experience and trauma that is experienced by a lot of BIPOC women and their non-birthing partners. And the learning has been extraordinary, extraordinarily profound for all of us. And it's not something nonprofits often get the opportunity to do, to listen and to think and to learn and to change. We're always, we're busy delivering, meeting that grant deadline, getting that program out. You gave us the space, and it means a lot to us and to our community. And I want to thank you for that. So, I'm keeping it short and sweet today. That's all I've got. That you can go ahead and click on the next slide, but I welcome any questions that you may have.
Thank you so much, Erin. Dr. Burke Harris.
Yeah, I've told the team at Aurora over and over again that these Grantee Spotlight events are by far and away the highlight of my day, week, month, you name it. It's really, really powerful to hear how you all have been, just everything that you've been doing on the ground. And it, of course, makes me feel good to hopefully feel like we're putting a little wind in your sails as you're doing this extraordinary work. So one question that I have is, in terms, what has the response been from the outreach in terms of the provider outreach, the general population outreach? I'm particularly curious about that. How has that been?
It's been big. For example, we originally only planned on hosting one Trauma-Informed Care 101 event. And we ended up hosting 3 of them because we had so many people sign up. And we wanted to capitalize on that. Our social media work and outreach, we just got some of our latest data in, and we got 1,500 page views in 1 month. So these are big numbers for us. We're also, being very consistent in trying to leverage our partnerships with other agencies, with those other grant recipients in the community, to use their mailing lists and their networks to share the word and get it out. And it's been amazing.
Oh, that's great. That's great. I had another question right off the top of my head, but it just escaped me. Darn it, I hate it when that happens.
All right.
So I love this. Can I ask about this? Oh, I remember one of the, have you have you, I don't know, this is kind of a question for Jen Ryan, but have all of our grantees been connected with Number Story and the work that they're doing? So that's
Yes.
great, it seems like there's a big opportunity for a bi-directional relationship of the ACEs Aware grantees informing Number Story and Number Story informing our grantees and resources and that kind of stuff. So
It's funny you say that because I just had a meeting with them yesterday.
oh, no way. Oh, awesome. Fantastic.
It's been connecting, so it's really great.
Oh, that's fabulous. That's great. I love the flashcasts. How long do they last? Like how much time do they take?
You don't get any more than 15 minutes.
Wow, that's awesome. That's like on your way to pick up the kids, right? Like wow. Okay, that's phenomenal. So I will ask the same question that I asked previously, which is, other than more money, which is always a resource, what would be most helpful to you in terms of helping to reduce obstacles, to catalyze the work, to move things forward?
You know, I was pondering that because I thought you might ask that as a question to all of us. You know, I'm really glad that the secondary campaign that you're doing with the general population is happening, right? Because we have a bit of a captured audience when we're working with agencies for whom it might be mandated to attend this, or they've, you know, they're doing it all together in a conference room now. But for the general population, for, you know, for the parent who's going to be bringing their child in, for the senior citizen who maybe has never talked about any of this in their entire life, doing that kind of outreach is so important. You know, we, on the maternal mental health event that we had a woman attend here in Sonoma County who works who's an in-care home provider for a senior service center. And she said to us, I have a woman that I'm caring for who's never talked about the abuse that she experienced from her father as a child 85 years ago. And it's starting to come up as her dementia sets in. And I do not know what to do. How do I don't even, what is this? What do I do? And we had, you know, one of the gentlemen who joined us from Ottawa, Canada, was a deli clerk. And we said, why are you here? And he said, I see a lot of trauma at my sandwich counter.
Oh my God.
Right? So the more we can keep hitting it from all angles with our general population, I shouldn't use hitting, it's a terrible analogy. The more
I get it, listen. Yeah.
Would be amazing.
Yeah, that's powerful. I completely agree with you. I think one of the things that I want to say, and this was a fairly intentional strategy, but it's very, very difficult to do, and it's even more difficult to do in government, which is that one of the things that we recognized, it was a trade-off. We didn't want to do a public education campaign and then have people go and talk to their doctors and none of the doctors knew what was going on, right? So that was like, yikes. So we launched ACEs Aware in January of 2020 with the thought that, you know, we would give it a certain period of time and then immediately launch a public education and awareness campaign so that people know what to anticipate. But it was it's tricky timing, right? It's tricky. We couldn't do both at once, and it's tricky to figure out how to do that. And so the fact that you all, as part of your grant in your communications efforts, included some resources for the public to facilitate them being able to receive that, right, when they go to the doctor's office, I think is really thoughtful. Very, very, very thoughtful. Wow. I'm just gonna say, oh, You guys don't understand. You guys don't understand. It's just food for my soul. To have the opportunity to see all of you, to hear the work that you are doing, to see how it's impacting the community, to go to your websites and see all of these resources, and to know that here in California, we are building this infrastructure, right? Like we're not just raising awareness, we're training our clinicians. We are creating networks of care. I'm sitting here listening to you guys talk about how this organization and this organization and this organization has a shared vision and shared metrics and accountability, how you're learning from each other, how you're borrowing from each other, how you're connecting, all to support families, to support our communities, and doing it in a way that is so mindful and practicing the self-care to support ourselves as we are in this work and thinking about sustainability. And it just, I just, I will say that this work this past year and a half has been a slog. I'm not gonna lie. It's been really hard. And coming in as California's first Surgeon General, and then having a global pandemic, like the worst public health crisis in a century, hit, and also launching ACEs Aware at the exact same time and trying to move it forward. And I know all of you have dealt with that same drama, like, oh my God, we finally got the funding to do this work, and oh, BT dubs, here's this pandemic and we can't even see each other or meet in person. But you guys, when I see you, it's so worth it. It's so worth it. It's so worth it. And I'm so proud of you, and I'm so grateful for you. And you guys just keep doing the work. And as long as, there's breath in my lungs, I will keep pushing and supporting and trying to bring more resources and supporting you guys to do this incredible work. I'm so proud. Thank you. Oh.
Wow. Kind of feels like I should just say thank you and good night. There's no way to top that. Well, I'll just say one thing that you told me one time, Dr. Burke Harris, which is their success is our success, right? It's one hand washes the other in so many ways. And so I just want to thank all of you. This is just one of the most inspiring part of the work that we're doing. So I can't possibly underscore more what Nadine is saying. So thank you all so much. Have a great rest of your day. This is available, it's recorded. So if you want to share it with those who maybe couldn't join us today, please do. And just keep up the amazing work. Thank you all so much.